Hi there, and welcome to My Blooming Health Mobile. This is the first of many series that we will have here for you to learn verbally and visually what you need to help bloom your way to healthy. My name is Danita Smith. Again, this is our first episode, and what we will talk about this time is maintaining your medical history. What is your medical history about? If you follow my blogs, essentially what I'm doing is turning my blogs into a visual, verbal learning experience for you to help you bloom your way to healthy. So some of us rarely fall ill. So when we do, which could be far and in between, 5, 10, 15 years, some people come into the hospital and haven't seen a doctor in 20 years. However, your history is extremely important, and we have to keep track of our history. So what I would like for you to do when anything happens out of the ordinary, whether it's something as minor as a tonsillectomy or major as an open heart surgery, these things you need to keep track of and keep records somewhere within your house. I would say create a file cabinet or find a shoebox, a large shoebox like a boot box, and name it Your Blooming Health. Name it to where whoever is taking care of you or whoever needs to find these records, if you're not able to produce them, they know what's in there. They know where to look. So have that available. We never know when we become incapacitated. We don't know if we'll be able to verbalize our past history. So you know what's going on with you, but can your family members regurgitate that information when they talk to your doctor or the emergency room? This is why you need to keep your My Blooming Health file somewhere handy so that if something occurs, unfortunately, and someone needs to speak on your behalf, they can speak based on your true medical history. When you go to the hospital or when you go to a doctor's office, you typically leave out with a bunch of paperwork. Don't just sign that paperwork and walk away. Take the opportunity to ask questions. Most importantly, what medications do you need to take to follow up with? And what medications do you need to stop? If you were taking medicines before, the doctor may have changed the name, they may have changed the dose, they may have changed the route. You need to know these things so that you're not taking duplicate medicines or you're not missing your medicines. You need to ask questions about your diagnosis. A lot of people walk away and they say, I have no idea what was wrong with me while I was in the hospital. This is the time to ask questions. What was your diagnosis? How do you manage it? How do you make yourself better? Don't walk away not knowing. I know we're all anxious to leave a hospital. Nobody wants to sit in there for days. And when it's time to go, you get that green light, you want to just run out of there. A lot of physicians, a lot of hospitals have purchased electronic equipment to where they are able to track your health record electronically. So you have this at your disposal. You can call up and say you want to know what your lab results were 8 months ago. You want to know what your chest x-ray was 15 months ago. You can easily pull that information out. However, you may have to actually sign up for this. So that you may have to create a password to log in. You may need a computer system in order to access those records. If not, you can go up to the doctor's office, to the hospital, and sign a release of information form and get your information. There may be a fee associated with it, so it may be beneficial that you have the online access. If you don't have your own computer, you can use one at the library or you can use a family member. So most important is that you do want to track. So that's all we have for this session. Come back. We'll post something every other Wednesday. If there's something important that you would like to know more about, you would like to know how to track on your own behalf, send me a message, write a comment. I'm listening. We can interact. So this is about you. This is about you blooming your health.